think this is tricky. And I mean, in my classroom, for example, when I assign students to go visit different religious communities, I said, do not go to any service that is not following the public health guidelines. And, and that, that's just the bottom line there. I think that I've always worried about saying something that will turn someone off, right? Like that will end the conversation. And so I think that, on one level, you have to be like, that is a conspiracy theory. That is not true. That is, we can't have a conversation when you're engaging in something that is so out of left field, right? But I do think that we have a responsibility to engage people and understand why they feel the way they do, right? What sort of, are they lonely? Is that why they want to keep going out to dinner at a restaurant? Like what's the issue here? And how can we talk about, the question of community and what community means in a time of pandemic? And how can we, and what kind of resources are available? What kind of inequities are creating more isolation for some people than for others? And so I think, well, there's like sort of there's a fine line between, being like, we need to be responsible scholars and advocates for public health, and also, and turning off that conversation where you don't have that chance to really advocate and change someone's mind. I'm more of a historian, so I always try to kind of contextualize everything in the past. But I do think it's important to engage people.
Right.